Hello everybody, my name is Councillor George Lindahl-Hammond and welcome to this meeting of the Adult Health and Social Care Policy Committee. It is really good to have many of our colleagues with us today. It's really good to see so many of you at our last meeting of 2022 and welcome to all members. We're currently being webcast and it is open to the public in person as well if they want. We haven't received any petitions or questions from the public at the moment. I don't think we're going to get any in late either. But let's make sure we've got our all our equipment off silent so we're not disturbed for the next 2.5 hours. We wouldn't want that. And there's no fire test planned for today, but should there be, please take instruction from the staff around, and the assembly point is in Tudor Square. Should we do a quick round of introductions just for the benefit of the public? I shall start at the far extent of to my left and move around to the right if that's okay. And go ahead.
Councillor Anne Woolhouse, I'm the councillor for Bayton.
I'm Councillor Kevin Oxley, councillor for Mosborough.
Councillor Ruth Milsom, Crooks and Crosspool Ward.
Councillor Angela Argento for Broomhill and Sharrowvale Ward.
Councillor Martin Phipps for City Ward.
Brilliant, thank you all. There's papers available for those that want them online and in person. A couple of changes to the agenda. Firstly, we're going to be taking item 13 first, which will that be item 8 in reality. And we've also, since the initial publication agenda, got an additional item, addenda number 18, improving wellbeing outcomes and tackling inequalities, etc., etc. And that's within a supplementary pack. We've got one apology for the committee today, and that's Councillor Aris. Okay, and I don't think there's any items requiring exclusion of the press and public. Can I just ask members if there's any declarations of interest on any matters on the agenda? Not seeing any. So if we can turn to page 11 of our reports pack, which is the minutes of the previous meeting, just take a moment with those, and then I would just like to propose that they are a correct record. Any dissent that they're correct record? Are we all in agreement that they're correct from the 16th, indeed? So recently, actually. As I said, there's no public questions. So now we'll just turn on to the work programme if we can.
So the work programme is all, as George said, available online or in the paper copies of today's agenda and papers. There are a number of, in Appendix 1, a number of new items, the majority of which were for today's committee meeting, one of which, the Sheffield's Mental Health and Emotional Wellbeing Strategy, has been put onto February's policy committee meeting. And there have been a number of rescheduled items also. This is an opportunity really for anybody to raise any issues they might have, anything that's been added, ask any questions that they might have. And as always, we really welcome member feedback for this item. Thank you.
Thanks, Fiona. Just one point out, I think it should be self-evident to people. I believe that where it says December 23 on the agenda, it probably refers to this meeting in December 22. Just so people understand there's no meetings planned beyond this municipal year. So the last meeting is in March, I believe. So that's as far as we go with planning. We don't plan too far in advance. Has anyone got any points of either actually or anything they would like to suggest or comment on? Councillor Milsom.
Thank you, Chair. Yeah, I do have a couple of questions. Just firstly, one specific one on the adult social care climate response. And I just wanted a little bit of information about if that's coming in February, whether the members of this committee will have a chance to input into that strategy or get a briefing on it and ask questions in advance of that February meeting. And I was also just wondering what the process has been in pulling that report together, if it's reaching the stage of approval in February. How has it got to that stage? How many outside bodies have been consulted? I think it might be good just to get a report on that in advance and have a briefing for the committee?
That's fine. Reading my papers here, it seems like health scrutiny are down to have an involvement in that. Whether that is your understanding, Ruth, or not, I don't know. But clearly, that's what I mean. That's just what's here. But aside where it needs to end up, I think we can absolutely note that that's something, if members are agreeable, of a wider interest to be dealt with at a collective briefing that no doubt we will have before that point. Is that of general interest of committee members that we involve the wider committee in developing that item? I think we all note that that's, you know, that item and like items have become of interest at the last council meeting at the time, so I absolutely think it seems sensible. Did you have another point, Ruth?
I did have another point, yes, thanks. It's just because I mean, through necessity, there's not a lot of detail in the work programme, obviously. These are just itemised. So there's a little bit of guesswork as to what lies behind some of the items. I just think with my scrutiny hat on, are there any items forthcoming on the work programme that would constitute any kind of significant change to service or change to practices for the workforce? And if so, I mean, under this committee system, scrutiny of social care items, I believe, does now sort of fall under this committee, although it's a little bit woolly around the edges exactly how it's supposed to fall between this and the Health Scrutiny Committee. But just to make sure that nothing falls through the cracks, if there are items there that involve a scrutiny process, again, it would be helpful to have something well in advance and be able to scrutinise it, you know, via a briefing session rather than trying to do it in the public meeting.
Thanks, I think it's a good point. I don't think we can answer that for individual items today, but I think in the way that we develop items through, that should definitely be a question asked to ensure that not only do items end up at the right point, but they go through that right process in doing so. So I would suggest that, you know, I mean, I know that Councillor Gentile and myself are intending to do, you know, a good bit of work in improving the way that we bring items through to be considered by committee, both to involve all members properly, but also to make sure that they come at the right time and come through the right place. So those kind of questions that are absolutely cogent and sensible, I think we should consider. So we'll have to pick up a conversation with you about that.
I really appreciate that, and I also really appreciate what a vast amount of work it is for you and Angela as co-chairs and the officers as well. So it's a big ask, but it's a huge amount of stuff on the work programme, and we just don't want to drop any balls. So I really appreciate the extra work that will take, and thank you.
No problem. Have we got any other points about the work programme at all? I'm not seeing any, so are we okay to approve that? In agreement? Yeah, okay. Brilliant. That's agreed then. Okay, so we are now on to our first substantive new item, which is the old item 13, and the new item 8. Get it right? Who got Joe and who got, yeah, here today? Just like to introduce yourselves for the benefit of members of the public watching the webcam. That'd be great. Thank you.
Hello, I'm Ian Menzies, Occupational Therapy Team Manager for Sheffield. Thank you.
And I'm Jo Pass. I'm the Interim Assistant Director for the Living and Ageing Well North Service. Thank you for accommodating the change to agenda. We're here today presenting the Equipment and Adaptations Eligibility Criteria Update. And there are two main components of our paper. First is detailing the next phase of the Equipment and Adaptation Recovery and Delivery Plan, which Ian will discuss in a moment. And the second component is outlining the current position and immediate plans for the Disabled Facilities Grant. The Disabled Facilities Grant, or DFG, budget has experienced what I can best describe as almost a bow wave of pressure following the COVID pandemic. During the height of the pandemic, to keep our customers and contractors safe and to comply with the guidance, we were only able to do the most urgent adaptations, which generated a backlog. This then combines with the recovery work we've done within our equipment and adaptation service, has generated even more work going through the DFG than we would normally expect. And as many of us are aware of, the cost of construction has also significantly increased post-pandemic. So those factors combined have put the DFG budget under unprecedented pressure, both in terms of demand and also financial pressure. So we are taking some immediate actions to support our practice, and we're proposing a strict adherence to the private sector housing policy, which was approved on the 17th of November 21. What that means in practice is that all major adaptations will be means tested for adults and delivered as a mandatory grant up to the value of £30,000, with a discretion by the Director of Adult Social Care to increase the grant to £50,000 in individual exceptional circumstances. People who are assessed under the means test will have a contribution to pay, but those people on passported benefits will not have a contribution to pay, and children's adaptations cannot legally be means tested, and due to this, the policy decision does not affect children. We're also seeking as a group of officers, both operational and financial, to continue to review and develop a further recovery plan for the DFG to ensure that it delivers for adaptations for people in need in a timely manner and is financially sustainable moving forward. And we propose to report back to this committee on those proposals in March 23. Ian.
Okay, so I've been asked to just present a few words about the eligibility criteria. So the purpose of having the criteria document is to ensure a fair, equitable and transparent way of enabling decisions to be made about equipment and adaptations provision across all tenures within Sheffield. The eligibility criteria set out the normal rules for eligibility by outlining the most frequently occurring scenarios where equipment and adaptations are prescribed by council occupational therapists. This criteria will ensure consistency and clarity both for assessors and also for residents of Sheffield. This is a duty that the council has under the Care Act 2014 to provide information about eligibility so that individuals and carers know what support is available to them. Crucial to this aspect is outlining the many and various funding arrangements for all the various adaptations and equipment, and also how this varies across different tenures. So the table at the back of the document clearly shows all of these differences to aid the public to make decisions about their situations based upon this information. So finally, the eligibility criteria document outlines the process for assessment, the eligibility criteria for all the different equipment and adaptations, and the funding arrangements for them across all tenures. This clarity will help assessors and the public to quickly understand the process and what to expect from it. Thank you.
I just want to invite any questions.
Thank you for presenting both. Councillor Mohammed, please.
Thank you. It's just a very quick question. How will discretion be assessed? So it says that discretion by the director will look at increasing the grant from 30 to 50. How will that discretion be exercised? So
we're not allowed to apply a blanket criteria because that fetters our judgment in terms. So everybody's entitled to an individual assessment. Occupational therapists are very sort of used to carrying out assessments, and it's about looking at the benefits for the individuals of any proposed exception to the criteria that we have to make from time to time.
Thank you. Angela, please.
Thank you, John and Ian. Could you just, for people out there, just briefly tell us how different is to what's happening at the moment? You know, it's really good to actually see it in a table because it's very clear. Is it fundamentally different what's happened so far, or is it on the back of what's happening? It's just clearer.
I think fundamentally it isn't it isn't different in terms of the work that our OT services do. Ian can add more to that. But what it does do is it provides that clarity and that transparency so that it's clear to everybody. And whilst we absolutely want to make sure we respond to the individual based on their level of need and risk, we always want to be equitable. And having this clear document helps us to achieve that.
Yeah, I think in addition, I'd just like to add that you sometimes, if you haven't got something written down, rumours start, and before you know it, we've got a policy that's actually, people are talking about a policy that's not actually what it's like on the ground. So it's really good for us to have that written down, because it stops some of those misconceptions about what we do and don't do spreading. Or
Thank you. That was a helpful answer to Andrew's question. I've just got a question, if no one else has got any hands up, just to follow on from that, really, which is, I understand the Care Act 2014 is the kind of key, the key act governing this, but there isn't as much national guidance around this as there might be around eligibility for other care services. Are there national guidelines or rules within the legislation about either things we have to deliver under this, or elements we cannot deliver? Thank you.
Certainly in relation to the DFG grant, there are clear guidance about what we need to deliver and the timescales by which we need to try to achieve that delivery. We've also to be financially responsible with the DFG budget, and there is, in that bow wave of pressure, quite a challenge to manage those two things, and that's what we're working to with our delivery plan and what we're setting to work on for the next few months. But yes, there is clear kind of statutory guidance about DFG. In relation to occupational therapy?
Well, I was just going to add that because the Care Act replaced a number of former acts, a lot of the duties and responsibilities were brought forward and then encapsulated in the new act. So although I can't put my hand up now and say exactly what they are, I'm absolutely certain that that's part of the process that went on.
That's helpful. Thanks, both. Are we seeing any more questions? If not, can I ask, are we all agreed? Is there any dissent to agreement here? I'm not seeing any, so I think we can say that item is agreed. Thank you very much. Thanks.
Thank you.
Okay, back on track now to item 9. We've got the unpaid carers treaty delivery plan. Will the officers come forward for this, please? Thank you. No hurry at all, but when you are both ready to begin, do you want to just introduce yourselves for the webcast and then present the report? That's brilliant. Thank you.
Hi, I'm Mary Gardner. I'm Strategic Commissioning Manager for both unpaid carers and direct payments. Hannah is my PA assisting today.
My name is Lee Teasdale-Smith. I'm a Commissioning Officer with a focus on support services for unpaid carers.
So we're here today to seek committee approval for the delivery plan for unpaid carers. It's a multi-agency delivery plan. For carers, we know that we need to set out a clear vision and delivery of our strategy. Carers need to be able to know what's being done to support them in the city, to help them feel valued, recognised and supported. So in this report, we're setting out our plans and the drivers for how we're going to improve services. We talk about our legislative framework, and over the next few minutes, myself and Lee will just talk about the plan, what it's aimed to do, how it fits with our strategies and development, and how we're going to put it into action. Okay. So this delivery plan that we're presenting is to enable us to deliver the Young Carer Parents and Adult Social Care Strategy, which was created in 2016. It also fits with our Adult Social Care Strategy in terms of living the life you want to live, particularly aligns with Commitment 5 around valuing unpaid carers within the social care workforce, but also across the city. Alongside that, it also supports our work and our strategy for youth services and also the inclusion strategy. And that's really important for our young carers and our parent carers across the city. So this plan aims to turn those strategies into reality, and the actions within that are going to help carers live the lives that they want to live.
Yeah, just to give you some of the background, on where it's come from. In 2016, the original carer strategy was agreed by Cabinet. The vision is that we are a city where carers are valued and have the right support to continue to care for as long as they want to. In 2019, carers and stakeholders agreed to extend the strategy, so it was put to them, should we come up with a new strategy, or do we keep what we have? And overwhelmingly, people wanted to stick with what we have, but just with refreshed carer principles. So give it a bit of a facelift rather than a complete overhaul. Those refreshed principles were approved by Cabinet in 2021. And yeah, carers and stakeholders said that they felt we didn't need a new strategy. And the delivery plan is to ensure that the care principle areas are delivered and that there is action taken. So it's reassurance in a way that that will happen. And this takes it back and aligns it with the carer strategy, those carer principles, those refreshed carer principles are the vehicle for doing that. So what is the carers delivery plan? Well, I think we've got a clear idea about what carers want, and we know it's been incredibly difficult for carers because of cost of living and because of coronavirus. So in order to respond to that, we need to work in a coordinated and multi-agency way with our partners to support carers. And this needs to span across adult, parent and young carers as well, because a lot of what they need is similar, if obviously nuanced and varied. There's a lot of similarity still. So the delivery plan sets out the detail to make that strategy a reality, and it's over the next 3 years. It's going to be something that we work with our partners on. So the council is taking the lead, but we're going to work with partners, including carers, to develop the plan over the next 3 years. But we have mapped out a governance structure so that everybody's clear in terms of what action is happening and how the work is progressing. The plan is split into two, so there's almost a strategic component and an operational component. I guess as it's in the tin, you know, the strategic actions require a bit more planning and alignment with partners, and the operational stuff is just things that organisations can do within their own organisation, or activities that they can do relatively easily. It also sets out in the plan who the owners of the actions are and gives an idea around delivery timescales. The plan will be published and shared, and the approach is very much that it's a live document, and it is something that will be worked on and refreshed on an ongoing basis. It's something that we will all work on over time. And obviously, as things progress, we're happy to come back to committee to give updates and let you know how things are progressing. Okay, back to Mary.
So I guess we wanted this delivery plan to be bold and ambitious, to make sure that Sheffield remains and is a friendly care, friendly city. That's really important. We want to make sure that carers are plugged in to a network which enables them to get the support for themselves around their mental health, around their well-being and their needs. So from the delivery plan, the key priority actions that we're going to focus on initially are around identifying carers. There are a whole group of carers that are carers for a long time, but also carers are a very fluid group, and often people don't even recognise themselves as carers, and we need to be able to identify who they are to be able to give them the right support at the right time and when they need it. We want to make sure that we've got better information available for carers so they know where they can get support from, but also for people that might be supporting carers so they know where they can get the support from, particularly around the city, but also employers as well. We want to create some practical tools that support people in their caring role. We've particularly found we've started doing some stories of difference, and that really seems to hit home and make a difference and talk to people straight. We want to improve the outcomes for carers. We want to make sure that they have more opportunities to influence what happens around carer strategy and the work that we do around carers. This delivery plan is a really positive change for carers, and it's something that we want to just take action on, not just words. That's what carers have told us that they want. They want to see what we're going to do and how we're going to deliver over the next 3 years. So if anybody has any questions, we're more than happy to take those.
Fantastic. Thank you both for taking us through those. Got any questions? Councillor Oxley first.
Thank you, Chair. Thank you very much. This is very comprehensive. I just wanted to raise one issue as a parent of a child who had severe mental health issues. And I won't go into the background of that. I really struggled as a parent, and I would then view myself at that time, because when she was a child, she's an adult now, in terms of, as a parent, trying to get support. The support that was wrapped around her was very good from a CAMHS perspective, from the GP perspective. But as a parent and as a carer then, who was trying to manage that child through school, through exams, through into adulthood, I felt that there was very little out there for parents in terms of, my child is about to do X, what do I do? I wondered whether you considered that within this strategy, in that I know from my background, from talking to other parents in my organisation at the time, that lots of other people were struggling as well to find that wraparound support in terms of dealing with children with mental health or anxiety issues. Throughout the plan, I don't see that much detail or even mention of mental health and if you like, parents. You talk about caring with disabilities, and yes, mental health is a disability, but I wondered whether that is something that you've looked at, or whether that's something that you might also want to consider within this strategy.
So yeah, absolutely. We want to look at all carers, and we want to recognise carers as carers within their own right. So like you quite rightly said, you will have had a lot of support around that, but then what's the support for you? This delivery plan is very much around a multi-agency approach, and we'll be working really closely with our colleagues at the ICB and Health, but also working with our all partners like the Carers Centre and also Sheffield Young Carers and Mental Health Services to make sure that we can deliver that. I think it's something we recognise in the plan that there is some gaps around information that's available and what support's there. And so together, collectively, we want to make sure that that's happening. We're really lucky in that we've got lots of support networks to be able to go to and talk to. You know, parent carers, we have an operational group that's going to help us drive this, and we've got lots of representation of carers there. So we would hope that they will keep us to task, I guess, but also challenge decisions. And if they feel that there's gaps, particularly around certain areas, that we are addressing those.
Just on the Carer Forum where we're involved, they are actively participating in the strategy as well. So, and I think, yeah, I would just echo what Mary said. I think the thing about carers is that no one agency can do everything. It is about working together. I think it is the best approach because carers are across different systems, but they're so vital to all of those systems, such as health, social care, and also education with young carers. So, but yeah, I think transitions is definitely something historically that has been difficult, and it is an area that we need to focus on. I think we know that. So.
Angela now, please.
It's not a question, it's a comment. I just wanted to say thank you for all the work that's gone into this, and I think it's just the delivery plan is like the second step, isn't it? There's the strategy and the delivery plan, and the delivery plan is what is going to set, keep us to task and where we can be challenged. So it's really good to see it in writing, and and now we can just get on with it and hopefully be there and be more effective. So strategically, I think it's a really, really great achievement for us to have this, particularly for carers, because they are often forgotten.
Thanks, absolutely agree. Unless there's any more questions, really. Ruth, hi.
Thank you, Chair. Just if you're able, I'd be interested in just a little bit more detail around how you go about identifying unpaid carers who are currently hidden in the system, and particularly where there are perhaps groups that are harder to reach. I don't know, in certain parts of the city or in certain populations, what kind of work are you able to actually extend to identify people into the system?
It very much depends on who you're trying to identify. So we know, statistically speaking, that 70% of carers are going through health services, either in their own right or with the person that they care for. So in terms of identifying carers, health is obviously a key partner when the carer is engaged, going through the various processes within health services. So there's opportunities there to identify carers and to link them in. And with the Carer Centre, who now have a health liaison worker as well, who is doing that dovetailing with health. Obviously, with younger carers, it's about education, the education system and schools. And Sheffield Young Carers are doing a lot of good work in terms of raising the profile. We now have a Young Carers Register as well, which was set up around 2020, which again is somewhere that we can put right names down. These are the young people that we've identified. So I think carers are across a lot of different systems, obviously within adult social care as well, and the various facets of adult and children's social care. We can be identifying carers there, and we're already doing work to try and up the volume of people being identified within adult social care. So yeah, it's quite a complicated picture, but it's essentially partnership working and continuing to push to raise the profile of carers, because I think often carers are overlooked and seen as almost, it would be nice to support this group, whereas I think we're really pushing to try and say, no, they're incredibly important to our city. They save the broader economy around £90,000 a year through their caring role. It's incredibly important that we support those people So yeah, there's lots of different partnership working aspects to it.
If I could just come from that, Chair, just specifically what can you do to reach into communities where English isn't spoken as a first language?
Yeah, I think again that's about partnership working. So, for example, the Carer Centre, they have a worker who speaks Urdu and Punjabi. So I think it's about working with community providers to raise the profile of carers, and obviously we need their support with identifying various communities of interest.
Thank you. Are there any more questions? I'm not seeing any, so do we all agree with this to be approved? And I see any dissent? Not seeing any dissent, so I think we can say that is agreed. Thank you. Just looking at the agenda, Mary, would you like to do the direct payments item next, or would you rather, because that's one down the agenda, would that suit you? Should we take that item, if everyone else is agreeable, next? Just that might make sense, if people are okay with that. So that will be then moving item 11 just above item 10, if people are okay with that. We'll take that when convenient. That's absolutely fine. Fantastic. So now we've got the elevated item 11 to approve the direct payments and personalisation strategic delivery plan. And Mary, you'll be presenting here again, if that's correct. Yeah, just get that right. Fantastic. Please go ahead. Thank you.
Okay, I'm going to be presenting with Andy, who is the Commission Officer. Do you want me to introduce myself again? Or
yeah, you can. It's probably fine. Or just Andy, just as you want. Yeah, sure.
Good afternoon, everyone. I'm Andy Buxton. I'm the Commissioning Officer for Direct Payments.
Okay. So in this report today, we seek approval for the Sheffield Personalisation and Direct Payment Strategy and the associated delivery plan that comes alongside that. We'd also like committee to know the progress made on the improvement programme to date on the direct payments offer. So we wanted today to briefly describe to you what direct payments are, how they fit within social care, and what the key themes and messages are within the strategy. We want to tell you a little bit about some of the achievements the programme has delivered and how we aim to deliver the delivery programme. I guess the first thing we need to say is that we recognise that personalised support is central to everything we do in social care. It has to be. The idea of putting people getting care and support in the way that's personal to them, that's built around them and focused on them, is always the right thing to do. And that includes all of our support and services, however we deliver them. This strategy, however, focuses on the support that's directed by individuals, that they're in control of, and they make the decisions about who supports them, how they're supported, when they're supported, and are able to flex the support around them in line with what their life throws at them. And this offer is mainly through direct payments. So just to give you a little bit of context of that, people that come into social care, if we identify that they've got a long-term need, we talk to them about the options that are available to them. We talk to them about the support that can either be arranged by the council through in-house services or through our contracted services, or we talk to them about arranging their services and support for themselves, with or without support. If they choose that they can opt for a cash payment, which is a direct payment. Okay, so personalised support and self-directed care is enshrined within the Care Act, and direct payments is also within the Care Act, and we have a very set criteria and set monitoring of how we set them up and make them payments. So back to the strategy, it commits us to this way of working, and it ensures that we put people first as citizens in Sheffield. We want to enable them to take power and control for themselves, to self-direct their own support and achieve the best outcomes they can choose for the life that they want to live.
The strategy and delivery plan are an all-age approach, so that's covering adults and children, and it's been co-produced with people with lived experience and describes how we'll continue to work collaboratively with people and our partners and stakeholders to shape, design and produce new and improved ways of working. The report highlights the key themes that the strategy wants to achieve, which are to see an increase in the use of direct payment, to foster innovation, creativity and strengths-based approaches, so we'll deliver improved outcomes for individuals, better experiences of care and support, and achieve better value for public money. We'll build on the work already undertaken through the Direct Payment Improvement Programme, which is to improve and transform the direct payments offer in Sheffield by improving process, minimising bureaucracy, evolve a diverse marketplace and improve opportunities for the personal assistant or PA workforce. Through the improvement programme, we've already achieved success by working with direct payments recipients and partners, including the ICB, and we've created a dedicated and specialist support service for people using direct payments, and we've got resources and fact sheets on the council website. We've got a tool to calculate PA rates of pay. We've set up a calculator for costing out personal budgets more accurately, and we've got a robust approach for quality assuring money management companies. We're embarking on a review of our current audit and monitoring process. We're developing the market and community options for people to choose from and use, and we're introducing individual service funds or ISFs to offer more personalised choice to those where direct payments might not be an option, all of which we can return to committee in the future to update with progress. It is our ambition that endorsing the strategy and moving ahead with the delivery plan, we will see personalisation across all aspects of adult social care. And this is because it's the right thing to do and we can offer choice from the start. It puts people in control. Knowing the budget up front allows for better support planning, and making a positive difference feels good for everyone involved. We're happy to take any questions you might have.
Thank you both for that. That's really helpful, and I think it's a really comprehensive piece of work, which is really timely as well. So thank you both. I've firstly got a question from Angela.
It's a question and, well, a comment. And thank you, Mary and Andy, for that. And Mary, thank you, because when we had the briefing on this, I think it was, for me, it was one of the most useful briefings, having had quite a lot of casework to do with direct payments, but had not understand how it worked before. It was really like a light bulb moment for me. So thank you for the clarity of how the service works, and I think it's really useful. My concern, as you well know, because I've raised this in the briefing, is about the shortage of PAs and how we ensure that people have access to good PAs, and especially when they have a PA and then that PA needs to go on holiday, have kind of backup for those. So I wonder how we're going to address that as an authority, because it's in a way it's out of our control partly, but how can we ensure that we put everything in place to encourage people to become PAs, so to explain to people out there what a PA does, because people think PA think admin solely, but it's not just that, is it? It can be anything. So how are we going to make the job of a PA that is very rewarding? How can we make it attractive, particularly to young people that might be in education and might have a few hours that they want to use to support someone who needs a bit of help because of their particular needs?
Yeah, it's a real challenge for us. I think, as we all know, the care workforce has changed dramatically over the last few years, and personal assistant workforce is no no different to that. I guess we have, as part of our programme of work, we've got a particular area of work around market shaping, and within that, we're looking at our workforce development around the personal assistant market. So personal assistants are actually employed by the people directly. So an extra complication is that they're not council employees. But that doesn't mean to say that we don't have a role in trying to look at how we can create and give a lot more kudos to that role of a personal assistant and explain what it means. So we're very much linked into the Adult Social Care Workforce Development Programme, and we have individual employers and personal assistants contributing to that. But one of the things that worked quite well during lockdown was having a register of PAs that were available to work, and that's something we are exploring a bit further about where we can have a central platform, I guess, where people can talk about whether they are willing to work and whether they can register themselves, but also where employers might be looking to employ PAs, where they can go to and advertise. So trying to create a better platform for people to be able to go. At the moment, people advertise and do things locally, and that works well for some people, but we need something to think about more generically how we can support people. We also know that we needed to think about how we can incentivise the workforce as well and PA, and help people feel rewarded and respected in the role that they're doing. I think that's really important, similar to what we said about unpaid carers. Paid workers in the support area or the care area is just as important. So we've been looking at, like Andy mentioned, we've created a PA rates tool which helps look at the rates of pay for personal assistants, so it's more reflective of the individual role that they'll be doing. But we're also working and trying to look at partners to work with us to look at different training and development opportunities that we can offer to personal assistants to help improve their knowledge and skills. We're also looking at different incentives and different products really that we can promote the role. So we've already got personal assistants that are able to buy into a mental health app that works called Together All. We're also looking at how we can support the care workforce, and particularly PAs, to think about how we can use different cards for different shops and different things, so how we can make it a more rewarding role and more incentivised, I guess. But it's always been a challenge for us to think about how we can explain what the role of personal assistant in this context is. We're looking at stories that we can have. We've got personal assistants that are willing to tell their stories and share what their roles are. And I guess you'll notice in the strategy itself, there was a number of postcards from the future where people described what it would look like for them. And we had some personal assistants that actually wrote their experiences within that too. So it's about getting that information out there and developing, I guess, a suite of information resources to feel useful.
Thank you. We've got any more questions for the officers on this item? Abby.
Thank you. I think the thing that I'm particularly interested in is in reading that in 2021 you worked with SACMA to do a review. What's the context behind that? Was there a particular issue within the African Caribbean community that we're not using the service? And have you used that model? Because I like the fact that you changed the model of delivery because of the feedback of that sort of consultation. Has that continued? Have you involved SACMA in continuous discussions going forward?
Yes, in the short answer. It was really important for us to recognise that personal assistants need to be available for everybody, and SACMA very much worked with us in terms of the workforce and how we needed to engage with different communities across a whole range of that. And one of the activities was around personal assistance and encouraging people to be that use direct payments to be able to be supported. So yes, we continued working with SACMA. We're also working into different communities as well to try and reach to understand what it is that they. We have more people from diverse communities using direct payments than other services, so we want to understand that a bit more, make sure that it's what people want and it's not something they feel that they have to go into, but also that we can support that workforce and understand the differences and how we can work together to create a stronger workforce and a more secure workforce, I guess.
So as a result of that consultation, individual service funds, so care providers could meet the needs of that particular community or any community that chose it. Is there a specific I mean, this is probably my ignorance, is there a specific requirement for those care providers, or could community organisations become care providers? So people that have, not people, organisations that have bigger reaches in communities, could they become those care providers, or is there a specific requirement?
So individual service funds, and Andy, you know much more about them than I have. You're working as the market shaping. We're working with a group of providers over a 1-year pilot to think about how we can embrace using individual service funds and making support more personalised. There isn't a requirement for providers, but we're definitely talking to them within the market about where they can see their support. I don't know if you want to talk more about what you've done individually.
Yeah, so individual service funds is an alternative way of deploying a personal budget. So where you have council arranged services, and obviously direct payments are on the other end of that spectrum where people have got that full choice and control. Individual service funds is like the middle ground. So the personal budget is paid to a provider, an ISF holding provider, and who works with that individual to plan out how their care and support needs can be best met. So that provider can provide, they might provide a significant amount of that person's care and support, or they may provide a smaller element, but the opportunity within an individual service fund for the provider and the individual to purchase support from different providers but basically subcontracting. So they could work with community groups and providers as well as part of that, different options and support that they can access that better meets their needs. And so really they've got that variety and they can change that as and when they need to and want to. So as part of the market shaping for direct payments and for individual service funds, we want to make sure that there's the wide and most vibrant and diverse marketplace that we can, which will have all sorts of different providers, whether they're more traditional care and support providers or community groups as well.
Any more questions? Not at the moment. So, are we all in agreement with this item? Any dissent? Not seeing you. I think that's then approved. And now we're going to return back up the agenda and thank Andy and Mary for that, and go back to item 10, which is to the Adult Social Care Co-Production Engagement Strategic Delivery Plan. Who have we got this? We've got Catherine and Liam, or we've got all sorts of people going. I've got enough chairs. Oh, they're just people moving around, are they? I can't count. Okay, that's fine. Hello both. Would you like to just introduce yourselves for the webcam before starting to start with the plot? Thank you.
Hi, I'm Catherine Bunton. I'm the Head of Service for Adults Commissioning.
And I'm Kate Damerel. I'm the Engagement and Involvement Coordinator. And we're here to present the Involvement Delivery Programme for the next 2 years. So I'm in a new role that was created in April to bring together our involvement offer for local community members to help shape and improve services across adult social care. So the role reflects the service's ambitions to create a culture where we're putting involvement opportunities at the heart of how we work. So I just wanted to introduce to you the core part of our new programme, which kicks off with the Citizens Involvement Project, which is a 6-month project to scope and develop and identify new opportunities for people to get involved in helping to shape and improve our services. We'll be building on our existing involvement activities, so that's our forums and partnerships where local people can already have a say and help us with our work. But we want to be more ambitious and to create new opportunities for people to get involved, attracting people across the range of services so that they feel that they can make a meaningful contribution in shaping our services. And we want to walk the talk. So this project is all about co-production. So we'll be working and designing these new opportunities with local people. So we'll be working as a team, sharing the design decisions and responsibilities. And actually, we've already started working in this way. So we'll be having an independent facilitator work with us for the project. And a couple of experts by experience have helped us to select this facilitator, creating the selection criteria and sitting on the evaluation panel to choose the facilitator. So it's definitely, yes, we want to walk the talk. So the project is aiming to create opportunities for people to inform our work so that we bring voices directly into our decision-making process. We want people to be influencing the way we work and the decisions that we make. And we want people to hold us to account. So the project will be looking very carefully at identifying practical opportunities for people to take on these roles. So what kind of activities are we actually talking about? Well, it's things like, for instance, mystery shopping, perhaps. Community researchers who are going out to talk to people about their experiences, and people giving their time to talk to us about their experiences as well. It might also include, for instance, people coming along to our new performance clinics to take a look at the data that we're bringing together and giving their interpretation of what they see. And perhaps even people coming along to these committee meetings to present their lived experience so that you can hear firsthand. And of course, all that needs careful support and provision. So we'll be mapping out how we can enable people to feel confident to take on these roles so it's a positive experience for them. We'll also be developing I guess, a comprehensive involvement offer. So all of these opportunities we'll put together in our new newsletter, for example. We'll be advertising them through the new consultation platform called Sheffield Have Your Say. And alongside that, we'll be running an outreach programme working with and through local voluntary and community organisations that work with client groups that traditionally we may not have had much contact with in the past. And we'll be looking at our partnership links to see where the gaps are and to make sure that we have comprehensive representation at our existing forums. So that's the plan of action for the next 6 months. Obviously, there's a lot there, but we're aiming to develop a comprehensive involvement offer for local people that then can enable us to embed that culture of involvement across all that we do.
Thank you, Kate, and well done for continuing and beating the Christmas caroling clock. I think it's a. In fact, I don't quite understand it as an innovation, but there we go. You know, I'm sure it makes the citizens of Sheffield happier at this time of year. This it's really welcome. And I think the fact that when we, when this council approved, our strategy for social care, adult social care, several months ago, I think that getting to this point was really important to not just about how we can organise our services internally, but making sure that the people, the only people that matter really in this case, people whose services they are, can be properly involved. So I'm really glad that it's been brought together in this way, and there's lots of exciting and interesting approaches to that. Can I ask if we've got any questions from members about what you said, all the reports? Ruth.
Thank you, Chair. Just a simple question, really, just to ask, you've probably conducted a lot of this work prior to the Race Equalities Commission report being released, but just wondered how you're working the findings of the Race Equalities Commission into this.
I think working with and through the equalities partnerships are going to be quite key for this work. So, I definitely think we need to be using the expertise of BEMA organisations who know who their communities are, have that trusted relationship with them, that we can then work in partnership together to build our own links directly with service users from those particular communities. But I think it's very much a question of working with and through organisations that do have that relationship.
Okay, Ruth. Have we got any other questions here? I'm not seeing any, so I think, can I ask, are we all happy to approve this item? Have we got any dissent? Not seeing any, so I think we can agree the item is agreed. Thank you. And so, moving on, we can then return to the normal order of our business onto item 12, and we've got Catherine here for the fair cost of care exercise item. Thank you. Oh, and Liam's joining too. Fantastic. We'll get ourselves sorted eventually.
Good afternoon, everyone. Liam Duggan, Assistant Director for Care Governance and Financial Inclusion.
Thank you. So this report asks for approval of the recommendations to allocate the 22-23 Market Sustainability and Fair Cost of Care Fund. We came to committee in September and talked a bit about the Fair Cost of Care exercise that we were undertaking, and this is a follow-on from that report, really. I think it's worth noting, and it is there in the context, that since the fund was announced in December 2021, the wider political context has changed, and we now know that there'll be delays to some of the social care reforms for 2 years, potentially longer, and that the future funding allocations are also somewhat unclear. That said, in line with the primary aims of the Fair Cost of Care exercise and funding this year, we are proposing to increase Sheffield City Council's standard rate for 65 years plus care homes by £18 per placement per week, and that would take our standard rate to £565 a week, and that will use approximately £1 million of the fund this year. And we're proposing to increase the rate for our framework home care providers by 20 pence per hour, moving towards the £21 an hour that we've got in our tender at the moment that was agreed in June, I think, committee this year for that tender. So an early step towards that rate, and that would use approximately £400,000 of the fund this year. And finally, the report notes our proposed process for setting fee rates for 23-24. It notes the other tenders that are out at the moment. Some of the procurement exercises are out for a number of services for adult social care, and that we intend to do some focused consultation with our residential settings on the standard rate and on non-standard rate, and we're asking committee to approve that, please.
Thank you. Have we got any questions? I've got a question. Just a question around, and I know this probably relates to the wider Fair Cost of Care saga, we might call it now, seeing as it doesn't really seem to have a good conclusion come from government. What is the reason why this funding distribution is targeted on those two elements, that framework home care and the older adults residential care, as opposed to, you know, why is there not an agenda from government? And I'm not asking you to speak for government here, but what's your understanding of why there's not an agenda from government on similar exercises covering many other forms of care and support that we commission or deliver as a council? Because clearly these are really important elements, but they're not the totality of care and support that we commission or deliver as a council at all.
Thank you. I can't speak for the government, but what I can say is that we note that as well, and that the exercise that we've undertaken, particularly with our domiciliary care providers, we've used that to inform the procurement that we want to do for the adults with a disability framework in terms of supported living, and what we're asking for in the tender and the financial implications, and what we've recommended there, because we recognise that the sector as a whole faces very similar workforce challenges and undertakes the same sort of work, and so some of those findings are applicable, as you say, to the wider system. The government, though, in their in their market sustainability and fair cost of care exercise are quite focused on the 18 plus domiciliary care and the 65 plus care homes in that exercise, and so those recommendations follow those guidelines.
Thank you. Andrew, please, and then Ruth.
Thanks, Catherine. I was just wondering whether, you know, obviously not in the public meeting, whether we could have the details, you know, of the cases that are mentioned in 1811 and in 1812, just to see how it works and why they are exceptional. Just to have an idea, so maybe as a committee we can have it like after the meeting as an appendix, if that is okay.
Okay, that's an affirmative. Okay, is that okay, Angela? And now Ruth, please.
Thank you, Chair. Looking at the amount that you've said is going to be passed on to 65 plus care homes and the home care providers. So, I mean, is there any control over how that additional funding is spent by the providers, and how much of it will end up in pay packets, and how much of it might end up getting absorbed in lost revenue, or dare I say it, profits, with the cost of living having, with the cost of everything having gone up for those providers? I mean, do we have any oversight as to how that money is actually used by the providers?
We're working closely with providers at the moment, and in the fair cost of care exercise we involved our providers as much as possible in understanding what some of the challenges were that they faced, yeah, almost unanimously actually our providers did come back to highlight some of the cost of living impacts on their staff, and their concern around their staff and the workforce came out as their number one challenge, really, both in terms of retention and recruitment, and making sure they were able to offer positive terms and conditions and support to the staff. The conditions from the government are quite clear, and they don't expect us to attach too many contractual obligations on it, but what I would say is that we will be noting when we go back to providers that the funding really is to support them in addressing the challenges that they have shared with us, and that I believe our relationship is getting stronger, and we're having some really good constructive conversations, and they're really keen to work with us on that, and we'll continue to do that as well as we look to our future commissioning of the services in the future.
Thank you. Martin, please.
Thanks, Chair. Just to follow up to Councillor Milsom's question, will we be able to review how it was spent? Like, will there be reporting from the providers on how it was spent, so we can kind of see if that kind of bears out?
Sorry. I'm very happy, yes, to talk to providers, to ask them for their feedback on how they've used that funding and the benefits it's had to their provision, both in terms of the quality of the service provided and their staff well-being.
Okay, are there any more questions on this? I'm not seeing any, so just with the agreement on this, are we agreed? Is there any dissent to that? I'm seeing agreement. Thank you, I think that's agreed. Thank you, Catherine and Liam. And moving on now, we've got the development of a new information advice and guidance platform. And we've got Tim Gollins for this report, I think.
It's what was item 8.
Sorry, yes, we have now reached the opposite time of the changed items, that this is the original item 8, which is now in the place of item 13. But now if we look at the other items changed around, I don't even know what item we're at. But we know we've got the right people here, and it is the development of new information advice and guidance platform. Has everyone got that? Fantastic. If you could both just introduce yourselves before starting the report, is that okay? Thank you for the webcast. Thank you.
Good afternoon. My name is Tim Gollins. I'm Assistant Director for Mental Health Safeguarding and our First Contact Service. And I've asked Dawn Basinda to come along, who's the Service Manager for our First Contact provisions, part of her personal development. It's good for her to be here. This report is effectively a really good news item. It's good in the sense that we've been working on this for a year, and we've got a new website that's up and available now, so it's a good piece of work that we've been working hard on. The need for information advice is derived from the Care Act 2014, and it requires the local authority to deliver three aspects of information advice. First of all, it requires us to explain care and support provision in the city. It requires us to explain how we do financial charging and financial assessments, and we have to do both of those in a way that is accessible and proportionate. And what that means is that it's suitable for different populations that require social care services. It's not just the Care Act that delivers the duties here. We've also got a social care strategy that in which information advice and guidance is very important. And the reason that that's important is that a year ago we did a self-assessment that followed the Local Government Association Towards Excellence in Social Care framework, and that told us very clearly that our then information advice offer was not suitable for the city. So we knew we had to do something significant about it. We developed a small leadership group that's been working hard. Dawn and I have been leading on that. And one of the first things we've done is develop a new platform for delivering our information advice through. The development of the new platform has given us a new sort of capability within the city. First of all, it's given us new editorial control. It's given us greater accessibility, or given people who use services greater accessibility. It's a lot more intuitive website, so it's navigable by the citizens of Sheffield in a much more holistic way. And it helps us with our demand management approach in First Contact, which Dawn will say something about shortly. And it's got future functionality that will help us address priorities in future years. There's two other areas of work apart from developing a new platform. One is around developing greater partnerships. So we've deepened our partnership with children's services, particularly the SEND work that they do, with health, with community colleagues and with housing colleagues. We're also working strongly with the voluntary community sector. We're also deepening the co-production work that we've been doing, and that's helping us develop better content. And with better content, we get better information to people. The current situation is that the site is live, and there's a link in the papers so that you can follow. So effectively, we've had a soft launch to staff. We're going live through social media in the new year to the public. In terms of costs, the new platform is £8,000 cheaper than the previous one, but there's been some implementation costs, so over the next 3 years it balances out. On top of that, we've got a co-production budget that we've ideally liked for 2024. If we don't get that, what it'll mean is that we have to delay some of that work until we've got a budget for it. There's no legal or commercial implications of this, but there will be some helpful reduction in the amount of paperwork we'll be able to, people will need to print out to work with citizens. And Dawn, I just wonder if you want to come in and to explain a little bit about how we could use that with our First Contact staff.
Yeah, thank you. So we are very busy in First Contact. On average, we get about 1,500 contacts per month. And very much a lot of the people that they're ringing in are saying, you know, well, I could have found this if you'd got a better website. This is very much about listening to people and responding to people. So it really is that good news story that we've been able to do this. So what we want to do is make sure that members of the public, by changing our answer phone message, will know that that website is up and running. So we can, as soon as we're ready for the proper launch, we can amend that answer phone message and direct people to that new website. But also what we want is our staff then to be able to use that over the phone, talking to somebody, and add items into a basket and then be able to send that link to somebody if they've got email address or if their family members have got email address. But what we know is obviously lots of people have lots of different abilities. Some have really good family members that have got online access, others might not and might struggle with online access. So we would then have the ability to print out and send out to those if they're needed. Or if they would struggle with that as well, we could continue forward in terms of our prevention, in terms of getting somebody out there to speak to somebody and look at more traditional methods of introducing that person to different things in the community that could support them going forward. So it's really looking at lots of different ways that we can support people and prevent, reduce and delay those care needs going forward.
And with that, I think we're able to ask questions, or answer questions.
Fantastic. Firstly, we've just got Angela, and then Abby, and then we'll move to this side.
Mine is a very quick question, so thank you very much for that. For this, I know that it's very exciting kind of news. So, are we saying that there was going to be one place where all the information about adult health and social care can be found?
That is our intention, yes. We're not exactly there yet, but that's certainly our aspiration for the forthcoming year.
Do you want to move around for Abby, and then we'll move around to this side?
Thank you. I think this is essential and it's needed. I think, you know, the amount of queries I get from residents as well that struggle to navigate the council's website. What would be useful though to understand is, because this is a different web page and it's very hard to find it on the council website, is on the council's main page, is there going to be sort of a box that allows you straight away to navigate rather than having to use the search function to take you to the new website? Because it's not readily available on the council sort of home page at the moment. And then secondly, I like the idea of an app going forward. Most people use their phones to access and search for information, but it doesn't seem to be sort of in the costings, the development of an app. Well, I mean, it's very basic costings that are provided here, but I'm guessing at some point there's going to be an amount that's requested for the development of an app. Is that already costed in, or is that something that will come back to the committee in future?
Okay, so with regards to the link to the corporate service, we're working on that. So you're absolutely right. There needs to be a seamless link between this site and the corporate website, and that is in our work plan for early next year, to make sure that there is a seamless movement for people between the two sites. And in terms of the app, the new platform providers do have an app. There will be an additional cost to that. So when we're ready to move to that point, we will need some additional funding.
That okay? I think we've got Ruth and Kevin as well. Yeah, Ruth first.
Thank you, Chair. Thanks. Abby, I was going to ask exactly the same question. So, assuming that most people, if they want information about something the council provides, will probably just start with Googling Sheffield City Council and arrive on the home page. Obviously, it's essential that there's something a button right there. And I just as well, I know this is probably nitpicking at detail, and I'm sure you've thought about it all, but I'm a bit of a details demon sometimes. So just about the name of a couple of things. Sheffield Directory is not like a catchy name that might mean something to everybody. I mean, it sounds like a phone directory to those of us who remember paper directories. And is that what it's going to be called, Sheffield Directory?
Well, it's a very good question. Isn't the same sort of functionality isn't called, you know, wherever directory in other places, they do have different names for it. We thought the first job of introducing a new platform was to do no harm. So first of all, we just wanted to get it launched and in a seamless way as possible. So we didn't want to get into lengthy discussions about what it should be called, rather just focus on getting a new capability in the city. If at some point we want to change the name of it, then we can do so, because we have that control over the website. I think at this point we're not planning to, but it's interesting feedback, and we can certainly do some work around that.
I think it's fine as long as it's, as part of the hard launch, is you know, explained actually what it is. It's that little pitfall, isn't it, of when you've used the same terminology a million times in developing something, it means a lot to the team, but might mean nothing to people outside. So it's maybe worth just looking at the comms around how it will be launched and how it will definitely mean the right thing to the right people. And just this is presumably replacing the whole the whole social care route from the homepage at the moment that is going to be replaced by this new one. So I mean, I like the kind of the icons and buttons kind of approach. When you drill down a little bit further, it becomes slightly less attractive with very small text links that might be quite difficult for a lot of people. I don't know if it's possible to get rid of links that are a lot of text or have an alternative alongside that's more visual with a shorter title. And just one other little niggle as well, local offer. It's another little bit of nomenclature that probably doesn't mean a lot to people. Like local offer is there with capital L and capital O as though it means something to everybody, and I'm not sure it does. So it might be worth looking at that language as well.
Onto those at all? Or?
Yeah, I mean, a lot of the content is actually not quite there yet, and that's why we're doing a soft launch at the moment while we're still working on the content. And that's why it's really important that this new provider, people can edit their own work. So all of the different people that, you know, are linked into this, they can go into that and they can change that. And also part of the functionality of it is that you can get it in different languages as well that can do the translate. So it is very much still a work in progress. We know it's not perfect at the moment. And the local offer thing, we're a little bit tied in the language of that because that's part of what we need to produce. That's what SEND tells us, that each local authority has to have a local offer. But yeah, I think
it just needs to say SEND, big,
yeah,
I think.
This is what it means. I think that's a really, really good point, and thank you for that.
Okay, brilliant. Kevin?
Thank you, Chair. The proof in the pudding will be, can the general public find what they want to find? And you've got some mention to it there, and obviously you're at the minute, you are developing that content, but you do that from an informed position in terms of you live and breathe this every day. So to what extent are we road testing that information to ensure it's exactly what the public understand it is and can see exactly where to go to make sure it's an improvement on what we've got existing?
Yes, and you're absolutely right. And the main way we are making sure that it's useful to people who live in Sheffield who use services is through co-production. That's why we've got a co-production network. So we're working closely with all various different providers, various different people who use services, to make sure that it's answering the questions that people really have, and B, that the search functionality is such that they can find what they want. So that is like painting the fourth bridge stuff, but we're on a continuous improvement programme throughout the next year to do that well.
Is that okay? Have we got any other questions? I do have one, really. So I'd like to echo what others said. I think in terms of, Ruth's question around, the name and things like. For me, I think having been in this kind of general field for a while, I think Sheffield Directory, for people in the field at least, has a good heritage, and as much as updates needed, I think the old version of Sheffield Directory was a useful resource, especially for professionals to direct people if it maybe lacked something in front facing. So I support that, and I think it's a big step forward. And I think although it's in development, it's going to be a really useful hub. And I'll start by saying that we obviously in this committee are asking you to create things to help us manage demand, which is obviously really important. But before this committee just now, I've been just trying to look through the draft site as it is, and actually there's some fantastic stuff on there about where you can go for all sorts of different things. But there's almost absent, and I'm sure it's there somewhere, is essentially how do you get in touch with the council if you want us to commission your care. And I appreciate, but absolutely, we want to give people every opportunity to live independently and find their way to serve themselves, because we have to have that as a council, and we don't want anyone to come through the council where they will be better off independently. But in your answer to Ruth's question, it said that this will essentially become the council's social care information. So is there going to be more information around how you do get in touch with the council, to get your Care Act rights, essentially, where that's needed. I do appreciate that it's a hard balance, because we absolutely want to make it as helpful so we can make sure that people's queries and asks are answered in an absolutely best way for them, which in many cases will be finding their own information. But I'm just concerned that at the moment it lacks easy enough access, perhaps, to those kind of basic things about how you do talk to us when you need us, because despite all the pressure, despite all the difficulty, we are and should be still there for people. Thanks.
Yeah, so one of the next things that we want to do is develop it further. One really good point, and absolutely, it needs to be up there, how you contact us. But what we want to develop is a self-assessment. So what some other local authorities have done in partnerships with people like PPL is gone through, so somebody can put, right, I'm struggling with my cleaning, I'm struggling with my shopping, and then it'll come up with, well, have you considered trying X, Y, and Z? And it'll come up then with a clever list that's through Google Analytics or whatever clever stuff that IT people will do, a list of things to direct you to. But then at the bottom of that, what we want is then to say, if you don't feel that this has met your need, please continue on to this further self-assessment. And then it can take some more details, name, address, all of your basics that we would need to ring somebody back. And people will then be able to fill out as much of that self-assessment as they wish to take them forward, so that then when we're getting involved, they're not retelling the story. So they're already halfway there then, if you like. And we would then apply the eligibility criteria and ring them back and speak to them and look at that. So it's very much kind of on our thoughts as in the next steps, how we can further support people and make it even cleverer in terms of supporting them.
That's helpful. Do we have a kind of timescale for introducing that sort of thing, or introducing, interim kind of things of that nature?
So there was the Care Act sort of additions that have now been delayed a couple of years. So with the care account, we were planning on developing that assessment process as part of that. So later this year, we will definitely have that assessment process in place, even though the care account's now been delayed.
Assume you mean later next year?
Yes,
or
yes,
this municipal year?
We're very excited, yes.
I commend speedy work, but no, that's helpful. Thank you. Any other questions here? No, I think we've had quite a few today, haven't we? So I'm just looking for approval now. I'm going to approve. Is there any dissent to that? Seeing agreement, I think we say that is agreed. Thank you. Thanks both. Really helpful. And so I think moving on, we have now got item 14, which is our budget monitoring report. I'm seeing Liz come forward. Welcome. Do you want to just introduce yourself for the webcast? Thank you.
Thank you. I'm Liz Goff. I'm the Head of Finance Business Partnering. I'm standing in for colleague Jane Wilby today, who can't be with you, so hopefully I'll do a report justice. So the report is for the month 7 financial position, which is the end of October 22. So we have an overall position there for the council where we are showing an 18.7 million overspend. The majority of that is down to the delivery of our budget implementation plans, the BIPs and the timing of those plans being delivered. The interesting bit for this committee is section 1.4, which is your health and social care, which is reporting 11.6 million overspent, which is slightly better than last month. We're getting better. Again, the majority of that is delivery of the BIPs, so 9.4 million of that is down to delivery of BIPs. Like I said before, that's down to some of the timing of actually getting those BIPs in place and the capacity to do the reviews, and a significant amount of those BIPs are around reviewing cases, and the capacity to do that is a bit of a struggle in terms of recruiting staff. One we need to keep an eye on is a trend in learning disability services. You'll see from the table there, which is headed up purchasing activity, that the 6.6 million overspend in learning disability services, so services we provide through residential care, care at home, etc. 4.4 million of that is due to the undelivery of bits, but actually we're showing a trend in there of 2.2 million overspend, so an increasing cost in our learning disability services. That's kind of the highlights for the report. It's not a lot different from last time we reported this, but I could say it is going in the right direction in terms of the overspend. Happy to take any questions.
We all like the right direction. Thanks, Liz. We've got any questions here? Angela.
Liz, just realistically, how many of those BIPs will be delivered in this year that are still not delivered?
It's a very good question, and you've got a report coming up later on this committee, item 17, which is going to go through your delivery plans and where you are. I think we've seen a lot of good progress towards those bits. It's quite key for 23-24 that we do get on and deliver those for full year in 23-24. We're assuming that's going to happen, but I think there's a challenge in the remaining few months. We're here at the end of December. We've got another few months to go before the end of the financial year. So I think there's a challenge there, but I think Liam, my colleague, will be picking up later in this report.
Yes, it does sound like a kind of Liam Duggan kind of question. We'll keep it in store. Is there anything else, any other questions for Liz? I think we need to, let's see, do we need to note or approve this one? Yeah, we need to recommend approval. Are we all agreed? Any dissent? Not seeing any. I think that's agreed. Thank you very much. Thank you, Liz. Right, okay, and now we're moving on to item 15, commissioning of citywide care at night services. Right, okay, yeah, just come forward, please. We're going to be multi-point. Does everyone who is contributing to this item want to introduce themselves? Start at my left, no matter where you're sitting.
So it's Alexis Chappell, Director of Adult Health and Social Care. And so I'm just going to briefly introduce this item and then hand over to the very capable Michelle and Janet, who are going to talk more about this. This has been a really good joint piece of work in between colleagues in health and social care to look at how do we review care at night services, but also take forward a joint improvement programme. And my colleague Danny Hides, who is a Deputy Director within Health, was going to be here today, but to co-present, which is why I'm here in Danny's place today. But ultimately, it's been a really good piece of joint work, and ultimately what we've done is look to extend for 6 months while we go and recommission, seek to recommission and take forward an options appraisal for the service. Ultimately, what we've tried to do over this last year is look at how do we deliver improved outcomes for people, but ultimately go and focus on reducing our waits and experiences for people, which is really what's been key to all of this. So I'm going to hand over to Michelle.
Hello, everybody.
Thanks, Alexis. Do you want to both introduce yourselves for the webcast? That's okay.
Yep, Michelle Glossop, Service Manager for the Enablement Team and Citywide Care Alarms.
Janet Kerr, I'm an Assistant Director and Chief Social Work Officer.
So the team that I manage has been leading on this piece of work, and like Alexis said, it's been a real collaborative piece of work. It's not been done in isolation. So really good outcomes for citizens of Sheffield, because we've worked together in terms of reviewing the support that people need and looking at alternative ways of delivering that, hence why we've got nobody on the waiting list at the moment, and we're down to 5 rounds across the city during the night, whereas a year ago it was 7. So we are very creative. We look at assistive technology, we collaboratively work with colleagues, district nurses, everybody in health to look at alternatives to put in supporting, because a lot of the customers tell us they don't particularly want waking up at night. if they don't have to be, but obviously if there's a health requirement, we need to. So it's been a real good joint piece of work, and people tell us that they are happier with the service because they're living the life that they want to lead, and they're not being woke up during the night twice when they don't want to be. I think the other good part of this is that people are getting reviewed on an ongoing basis, and we've got a lot of confidence in the provider that we're using. So we've actually built a very good relationship with them, that they actually review somebody as soon as they identify that there's a change. So instead of alerting us and waiting for us to contact them and go out and review that person, the provider reviews them imminently and then lets us know that they've done it. So that person is not waiting to either have an increase or decrease in their support. So it's really timeless, really good quality service because it's very reactive. If there are difficult situations, obviously we're there to call upon and we intervene with support. We don't always go straight in and put support in. We do look at alternative options so people are getting, you know, a good service, and we're not sort of being obtrusive in their life, but making them safe and able to continue to live at home. I think we just need to build on the learning and continue to work in the way we do, but gatekeeping to some extent, that we've got the support mechanism there for the provider that we're working with. So even when we re-procure, I think we need to continue with a good relationship to make sure that they know that we're there to support them and get the best for the citizens of Sheffield.
I mean, I would just add, I've probably said it sitting here before, but our issue is less about the care we put in the first place, but more about how quickly we review people's care. And I often, and this is particularly pertinent to care at night, often we put care at night in following a hospital stay. And it's very, very hard if, you know, the example I sometimes use is you've got someone who's 88 with dementia, might have been in hospital 5 weeks. How do you make a judgment from their behaviour on a hospital ward about how they might be when they go home? And sometimes people in that situation, as soon as they're in their own environment, it's like a light switch comes on and they can manage because they've got all their own familiar things around them. And I think the difference having Michelle work in this space and her colleagues, one, it's the way Michelle trains them, but the other bit is they're reviewing from day one. So it's about going in and having a close eye and removing the care if it's not needed, because obviously if you leave care in, one, there's the issue that sometimes people just don't want it, but two, often people get used to it and their families get used to it because it feels like a safety net. So I think it's the combination of the care and the review working together that's helping us here. So I think it's working very positively, and as Michelle and Alexis both said, it's about collaboration with our health colleagues, but we've got more to learn, and you know the 6 months extension will take us to that place.
Absolutely, and Janet's right, we get the two extremes. People that come out of hospital and we start going to visit and they say, we don't need you to come. People present differently when they get home in their own environment, they're more confident. So we do get that, or we get people who deteriorate when they get home and need a little bit more. So it's really important that we get there really quickly and that we don't leave people, you know, to deteriorate or not have the right support to maintain their independence and get good outcomes for them. I think there is something about setting expectations as well, because once care's in, people like to keep it. It's very difficult. So I think if we don't get in there quick, it makes our job a lot harder to then start saying to people and having very difficult discussions about, you know, you don't need this support. And generally people have got those expectations. So it is really important that we get in there really quickly and review people.
Okay, thanks both. Got Abby?
Just a very quick question. So the extension is just for 6 months. Do providers, I mean, the stability of providers has got to matter as well. So what are we doing to ensure that longer term contracts are going to be in place? Because I can imagine that this will be a relief for them, knowing that there's an extension for 6 months. But having worked on the other side of this a very, very long time ago, if not for this particular sector, just in the voluntary sector, knowing short-term contracts are very sort of difficult to manage. What is being done to ensure that longer-term contracts, or is that just because we're in a difficult financial strait within the council?
The provider who does this contract are a very long-standing provider who do a lot of work, mostly actually for our health colleagues. So, I mean, in a sense, I don't think there's an issue about them being given a short contract. It's more us getting them to agree to doing the contract. I think it works the other way around. So I don't think there's anything in terms of sustainability for them and their business.
I think it's a good point though, just to say, because the previous provider, we struggled with quality, whereas we do have the quality with this provider and they're working with us, and we've got that engagement in terms of getting the feedback and reviewing people early on. But I think, like Janet said, I think it's more about just extending it while we continue the evaluation of how we've been working over the last sort of year.
Thank you. Unless any more questions, just to follow up on that really, it might be helpful if you just clarify for the committee what roughly the next steps beyond this will be towards that longer term. So in terms of timescales, when when we might expect to be assuming you'll be looking to seek approval from the committee at a future point for a longer term contract. What timescale that might be within.
I think we've put to come back to committee in March. We will be coming back in March, so we've already started some work and we'll be coming back to you.
That's great. Are there any more questions? Not seeing any, so just seek agreement. Has there any dissent to agreeing this? I'm not seeing any. I think we say that is approved. Thank you both very much.
Thank you.
Right. Moving on, we've got item 16. Which is the Adult Social Care financial update and progress. I'm not going to say the rest of that. It's item 16. Is it Alexis you doing this? Or is it Liam? No, sorry, Alexis. Liam's next one. Alexis, absolutely, turn to you.
So I'm just going to start off by saying a thank you to all staff across social care and across health, and our teams, and particularly our leadership team and our members. And I start by saying that because at the start of this year, we entered this year with Omicron. And I thought I'd just do a bit of a reflection of how this year's went. We started this year with Omicron, where we had probably one of the most significant events to happen within social care. And that significantly impacts on people, our workforce, and what we were doing. And that was a significant event. And that was the start of our year. But at the start of it, but at the same token, we also made a commitment to also, and a priority towards delivering a strategy for adult social care, to delivering to clearing our waiting lists, and to also setting the foundations for long-term sustainable change across adult social care. And over the past year, we have delivered upon that. There's been a huge amount of work by my team in particular, who have really taken forward and delivered a range of the milestones that are within the Council's delivery plan, the one-year plan, which have been heard through committee actually over this last few months, and equally which are also planned for the future. And, so we have absolutely delivered upon these. But equally, we've refocused on trying to get to long-term sustainable performance improvements. And, what we haven't tried to do is do quick wins. What we've tried to do is get underneath it all and say, what's the root causes of why there's been historical issues, again, particularly issues to do with reviews or accessibility of our services, that can get underneath these root causes and then make the improvements so that ultimately we get to longer term sustainable change, which is affordable ultimately in going forward. And, if I look forward to the next year, we've also got a range of developments that are underway, which are also planned for approval, which again are great collaborations. And ultimately, these are about, establishing a mentally healthy Sheffield, an autism inclusive Sheffield, a workforce development plan for ultimately not just for right across the care sector and for our council staff, so that we empower and enable and value our social care workforce, and equally enabling and supporting people who live in residential care to live the life that they want to live, but particularly building upon the recent Health Watch report and looked at the transitions of people. And then finally, how we inform and improve our approach to early intervention and prevention. What we're doing through all these developments over the last year and everything that's been brought to committee, but equally all the performance improvements, is ultimately doing what people told us to go and do. And I remember when I came to Sheffield 2 years ago, actually pretty much to this month, is really doing a listening exercise with many people. And what people told us is that they wanted to improve our information advice offer, they wanted to improve our approach to carers, they wanted to improve our approach to direct payments and personalisation, but also have a robust workforce strategy, but get to sustainable improvements which enabled us to deliver accessible, excellent quality services. And very much, you know, through our future design, through all the work recommission activity that we've been endorsed by the committee this year, we're certainly setting the foundations and on the right trajectory towards doing that, which is good. And so again, I just want to say thank you to all the team and to everybody who's come on today, and particularly all the good collaborations that we have with our health colleagues, which you'll hear about later on today, but also with our colleagues across the voluntary sector, housing, and also the independent sector and our providers, who have worked extremely well with us to go and find a better way forward for the citizens of Sheffield, which is what this is all about, as people and carers of Sheffield. That's what this is all about. And so that's really just what I want to say at this point in time. And what's attached is basically our one-page summary of our delivery plan, but also our milestones and our progress in terms of the council delivery plan. And one of the key things that we were asked to go and do was to evidence that progress, and hopefully committee can see is that we are making a trajectory. There are still areas that we need to make improvement on, but however, we're on track and we're starting to make these improvements.
Thank you, Alexis, and thanks for your good wishes to the committee. And I just want to say, it's been a year of change for the whole council, hasn't it? And but I think we can be really pleased by the amount of kind of developmental and strategic work that has happened this year. It's been probably, I think, certainly there's been more of that that kind of thing in a really positive direction than at any point, I think, in the last, well, I can certainly say last sort of 5 years, although obviously coronavirus hasn't helped some of the more recent ones. So that's a really, really positive direction we are on. And I hope that 2023 can be not only completing some of that, but also reaping some of the benefits for the quality and sustainability of a lot of the services we deliver, because ultimately we can do all this stuff and we sit around here and doing our reports here and the wider work of adult social care. But if we can't make that translate into the actual services that people receive, then that's only half the job. So thank you from me for all your support to the committee and us as the lead councillors. And I'll turn to Angela.
Yes, thanks, Alexis, and I would like to pass our thanks to all the staff as well. We say regularly, but it's seeing it firsthand. It's quite amazing, considering all that is going on, that people manage to do as much as they do. Just in terms of the delivery plan and the ragging, there are a few items that are red, and obviously the targets are set for June 23. How do you feel? Some of them are still rated red, and in fact, in terms of the median time scale of days to determine if support is needed, has gone slightly up since July. But is the direction of travel is it going in the right direction for us to meet those targets by, in 6 months' time, basically?
Oh, yes, absolutely. So apologies there. Yeah, absolutely. We have, we're going in the right direction, particularly with reviews, because reviews has been a historical issue across adult social care. And one of the key issues that we reflected was both the data quality practice, but also how we are recording what we are doing and how we work in a very different way across adult social care. And actually the Care at Night example was a really good example of how when you work differently, we can achieve really good results. And there's a lot of that going on right across adult social care just now, right across all the different teams. And then particularly as we implement our future design of adult social care, which was approved in November, as we move towards an adults with disability services and as we move to living, ageing and well services, and also bring back mental health social workers back to adult social care, one of the key things that we'll be able to go and do is by working in a very different way is evidence that practice improvement. So we're absolutely on trajectory, and I think what we'll start to see is come next year is these hopefully all shifting towards green, which is where I want us to be in adult social care.
Is that okay? We've got Ruth now, please.
Thank you, Chair. Thanks, Alexis, for the report. It's been interesting to read reports as they've come over the various months. So coming into this as a new member in 2021, and then coming onto this committee this year and seeing more and more of the work you've been doing, I think it's really good to see such a solid trajectory through the reviews, and you can kind of see your end goal. Which is really reassuring. I'm just really curious. This is not a challenging question at all. I wanted to give you an opportunity really to express what you've done about sort of addressing silo working and what kind of a difference the process of reviews might make, and how what opportunities there are for drawing services into more understanding of each other. Because service users obviously, slip slide across various services, perhaps across their lifetime. And if those providing the services are working in those little pockets, not referring to each other, there's a bit of a mismatch. So I just wondered really, well, I'm sure you are excited about it. You can tell us.
That's a really good question. Thank you for that one. Absolutely. For me, that's been one of the core to all this, as to how do we get to joined up services that mean that people don't have to tell their story different times. And one of the things I was really struck by is just listening to people when I came into post is the multiple different places that people need to go to get support. And actually what Sam was talking about earlier on really struck a chord with me, because I've heard that so many different times. And there's three key pieces of work that's going on just now, which I think will help us to get to a more joined up position. Is number one, through the future design of adult social care, looking at working in a very joined up way with colleagues in primary care. And I think we've committed to coming back with a joined up report in the future about how we develop that joined up multidisciplinary working in communities across Sheffield, which from a point of view of kind of that first contact services, it's all primary care and social care, which are really the first point of call. So us joining up makes it easier from a point of view of individuals. And then secondly, one of the key other pieces of work that we're doing is working jointly with colleagues in housing and also communities colleagues to look at that joined up neighbourhood, and particularly at the work sort of front door of adult social care, where often people go between services. So what we want to do is between information and advice hub and equally redesigning how we think about early help services, and particularly is we have that joined up working particularly with communities colleagues and housing colleagues. And then third, through our range of joint developments with kind of health colleagues and with voluntary sector, is looking at how we join up, particularly with support to people who are autistic and who experience mental ill health, because we also know that through speaking to people is that sometimes it could feel quite disjointed between the services. So that's where a lot of the work's going on, to try and bring things actually far more closer together and be more straightforward for people. And one of the things that I have a privilege of doing is I chair the Autism Partnership Board. And I actually, on a personal level, love chairing that board, because what I hear often from people and family members and people people who are autistic is how the world could be very sometimes quite difficult to access in terms of health and social care services. And so very much listening to people on the board and listening to people through many activities, that's where we came back down to, is joined at work in my primary care, joined at work with my colleagues across community and the housing and voluntary sector, and then joined at work and right across strategically with partners right across the city. So that ultimately, from a point of view of individuals, what I would really love us to get to in Sheffield is people we need to tell their story once to get the right support at the right time.
Okay, thanks. Are there any more questions on Alexis's report? If not, then we have to agree that. Any dissent? Not seeing any. Okay, that's agreed. Thank you, Alexis. Okay, moving on, we have got item 17 now, which is our financial update, and I think Liam's coming forward for this. Liam and Jonathan. Hi, both. Do you want to introduce yourself? Actually, Liam, you have already, but just introduce yourself for the webcast, that's okay, and then please present. Thank you.
Thank you, Chair. Hi, everyone. Liam Duggan, Assistant Director for Care Governance and Financial Inclusion, and with me.
Good afternoon. Jonathan McKenna-Moore. I'm the Acting Service Manager for Business Planning and Governance.
So, this update then is the regular report that we provide to update on progress with the Financial Recovery Plan and with our improved financial governance arrangements in adult health and social care. The paper starts off with a bit of a recap on where we're at with the 23-24 budget position, £26 million worth of pressures and just under £22 million worth of savings reported to the Strategy Resources Committee on the 5th of December and work in process on the remaining gap. Also to note, importantly, the autumn statement on the 17th of November, which has changed a few things. Most of those things have changed. We're waiting for the detail to land later this week before we understand exactly what the implications are, but we do know that the National Living Wage has added significant pressure, addition to that which we budgeted, but we're anticipating that the government will be providing the funding to meet that challenge. There's a note also in there around our medium-term business planning when we come back in the new year. When we've got further detail on the autumn statement, we'll be starting to put together the arrangements for budget planning for 24-25. So that's coming up quite quickly. The main body of the report is on the in-year position. Jonathan's going to provide us with a bit of an update on that one.
Thank you. So the main report provides an update on the delivery and forecast delivery of the planned savings for the year, and Appendix 1 provides the detail of those savings line by line. There's been an improvement of 300,000 in the forecast since the last update that was provided in October. There's been some movement up and down within different savings to get to that eventual number. And as a result, we're looking at a 9.3 million shortfall of the delivery of the 25 million target. So just short of 16 million to be delivered in year. So this was touched on an earlier item, and there was a question about how much of the business improvement plans should be deliverable. So from that just over 9 million shortfall, there's just 1.1 million of that we're saying is not deliverable now. And that relates to the increase in costs in year that we were hoping to mitigate, and we've seen those increases come through, so that's not recoverable. So we're going to have to find some other mitigations for that. For the remainder, it's mainly related to reviews, and we had some delays implementing the reviews as planned, but we are seeing those savings come through now. So if we continue the activity into next year, that's about 7 million of the shortfall that should be recoverable in 23-24. The other million relates to some staffing costs and some contract costs that again is recoverable next year. It's just not deliverable in year. So yeah, that will obviously carry forward as a pressure into 23-24, but we do have some plans in there to address that in year and recover the position. That's it.
Okay, thank you. And then the last piece is there's a couple of updates in there around improvements to our governance arrangements. So an update on the arrangements that we've put in place for establishment control, the progress we've made in developing out the contracts register. There's also an update in the appendix on the LGA recommendations and a further breakdown of COVID grants for the record.
Thanks both. That really helpful update, covering a lot of ground there. I don't know if Andy felt that addressed your point particularly, or you want to just go a bit further on that?
Thank you.
Any more questions for Liam or Jonathan? I'm not seeing any, so if that's okay, are we happy to approve this? Anyone dissent from approval here? Not seeing anyone, so I think we can say that's agreed. Thank you both. And now moving on to the final item, which was listed, I approved for urgent consideration. It's item 18, which is improving wellbeing outcomes and tackling inequalities. I think we've got Sandy from the ICB here today. Welcome. Just like to introduce yourself for the webcast. Thanks.
Thank you, Chair. Hi, my name's Sandy Buchan. I'm Director of Strategy for the Sheffield Place of NHS South Yorkshire ICB. And I just want to say that this paper is a combined collaborative paper between myself and Alexis Chappell, and you'll see the whole theme of the joint collaborative working throughout. So I just wanted to recognise both involvement in the paper. So the purpose of the paper is to provide the committee with the overview of the joint working across health and social care in Sheffield, focusing on the improving outcomes and closing the gap on inequalities for the residents of Sheffield. Over the last few years, health and social care colleagues have been working collaboratively and together to commission more joined up integrated care services, and it continues to be a key commitment both in health and social care to have effective partnerships and relationships which contribute to the improving the lives of Sheffield citizens. There has been significant work undertaken to build these partnerships and relationships, and this report provides that update in relation to the actions contained in the Council's delivery plan, but also seeks endorsement of an approach that we've developed in terms of a Sheffield outcomes framework. So I won't duplicate conversations that have already happened today in relation to the Council's delivery plan, but it's to recognise the good progress that has been made on joined up local services that has been discussed, the joint wellbeing outcomes, which I'll discuss in a second, the setup of a joint quality framework, which is a joint health and social care quality board that's been developed and used as a foundation for developing joint monitoring and quality across a health and care commission provision, the new information advice platform, which has already been discussed, and early help and intervention, which a working group has been set up, which enables people to live independently and healthier at home for longer, which the workshop has been arranged for January. Over the next 6 months, it's also planned to progress delivery of a joint NHS and social care financial and strategic plan, so we can evidence how we are using that joint funding effectively between health and social care. So moving on to the Sheffield Wellbeing Outcomes Framework, we've created this framework to enable us to evidence and challenge ourselves to ensure that we are having the right impact for our Sheffield people and communities. The framework itself was set up to really ensure that the citizens' voice was at the heart of what we're doing, and that they can tell us whether or not we are having the services that we commission is having the right impact for them, so we can really make that difference and ensure the difference is being felt by those accessing services. We're triangulating both that feedback evidence, the population health intelligence, and service level indicators and metrics to really get that full picture effect that what services we are commissioning across health and social care is having that right and much needed impact and meeting the needs of our population. So not only will it have that level of insight into whether or not it's having the impact, we will also challenge ourselves. We have set up already a steering group that has health and social care colleagues, but also voluntary sector colleagues and partners on there as well to really make sure we are providing that challenge inside. We're also wanting to make sure and ensure that all our organisations across Sheffield, so all the partners across Sheffield, continue to be committed to delivering the outcomes and annually reporting our progress against our vision within this space. And we brought it here today to really recognise the importance and value we have on that outcomes-based approach and really have it as embedded within all the committees and partnership frameworks we have across Sheffield. And I will just ask Alexis if there's anything additional that you want to add. Thank you, Chair.
Thank you. This I will bring Abby in a second. I just want to say, I was involved in some of the workshops and things happening on this. It feels like quite a few months ago now, and so I'm really pleased this has come today. And I think this is one particularly to note ourselves because there's some really progressive and I think really excellent commitments in here. The big task now is going to be how we can actually make that live and breathe in commissioning and other service planning. And I think there's going to be a lot of work on for committee and officers to make sure that happens. But I'll bring Abby in. Thanks.
Thank you, Chair. And it was exactly that point that I was going to sort of probe a little bit more on. So it's excellent that we're going to an outcomes-based approach. Does this mean that funding will change to reflect the outcomes-based approach, or moving towards a sort of a preventative model? I think the thing that I'm trying to sort of avoid is the language and the rhetoric all changing to what is excellent in terms of having a focus on outcomes, but actually the delivery not changing to reflect that. So is the ICB's funding model going to change to reflect the position going forward as well?
I would say that there is an ambition for that. I can't say today whether or not that is where we are currently, but by providing more intelligence and more scope and more emphasis on outcomes, very much then aligns within that. So the partnership structure within Sheffield, we've all discussed this to be the centre at the heart of all forums, so that really has the citizens' voice right at the centre of the decisions that are being made. So outcomes, from my perspective, is very much as part of that whole decision process in which finances are an aspect of it. So it is certainly the ambition that we want to work towards.
Okay, thank you. Any more questions? I think given your point there, Sam, obviously I recommend that we approve this, but I would think we should just note that perhaps it might be useful to bring back to committee, perhaps say March or another time, just perhaps a brief update, just in terms of how this is being embedded. And we wouldn't necessarily have, the final answer for how that's being embedded across health and social care commissioning, but it would be good to have an update because, at this point we don't expect to see any evidence of that because it's just being approved. But hopefully by March time we might start to see at least some positive directions around that. So, obviously I think we should approve this, but if the committee would be agreeable to bring something back in time, provisionally say March, that'd be really good. Okay, yeah. Yes, so in terms of the recommendations, sorry, if I've missed this in the recommendations, apologies. But that's fine.
Yeah, it says agree that Director of Adult Social Care brings back 6 monthly reports on progress.
6 monthly, okay, 6 monthly. Well, 6 monthly. Yes, well, it's fine. Yes, absolutely. 6 monthly will probably be the first meeting of the new municipal year, which, if the committee's fine with that, yeah.
I think the only thing to add to that, Chair, is the Director of Adult Social Care is Council. It'd be good to get the ICB to report back as well.
Yes, well, absolutely. We should confirm that any report should definitely be jointly created. That's fine. Alexis, do you want to comment on that?
I was going to suggest perhaps an amendment, good point, is perhaps that the Director of Adult Social Care and the Director of Strategy and Commissioning also brings back a joint report every 6 months and suggests that perhaps we could bring it forward to March, if that's helpful, taking on board your point, if that's helpful.
I'm not particularly precious about March, but that was just before saying that. But no, that sounds sensible. I think whether we formally change anything, I think it's just useful to kind of note the committee's general acceptance of that. I think we'll be fine. I don't think we necessarily need to amend the recommendations particularly. Is everyone okay with that and okay with this report? Any dissent on any of that? No, I think we can say that's agreed.
Thank you very much.
Thank you, Sandy. And so that brings us quite close to the end of our agenda. But it is incumbent on me to say that to committee members that right now there is a governance review drop-in happening just next door in the anteroom where I am reliably informed there are mince pies. If there aren't mince pies, then we're all in trouble, aren't we? Which we are encouraged to pop into, being that it's so easy for us and we have finished 14 minutes ahead of time, so there's no excuses. But other than that, just say that the next meeting we will have will be on the 8th of February at 10 a.m. Thank you all, and yeah, thank you all for your contributions today.